Many urologists believe anecdotally that prostate cancer screening rates have declined since the U.S. Preventive Services Task Force recommended against screening in 2012. 3 studies presented at the AUA annual meeting appear to confirm that belief. Study authors and AUA spokesperson Sam Chang took a closer look at this issue and the most current data on trends in prostate cancer screening by primary care physicians.
And essentially what we found was there's greater than a 50% decline in PSA testing rates before and after the U.S. Preventive Task Force recommendation. And essentially the men who are most likely to benefit from screening, the 50 to 69 age group, saw the greatest reduction in their PSA testing.
Researchers from the University of Massachusetts in Worcester discovered that 75% of primary care providers have changed their PSA practice patterns based on the 2012 recommendations. 95% of providers surveyed were familiar with the USPSTF recommendations, and the majority of respondents believe routine PSA screening offers more harm than benefit, says first author Jennifer Yates.
We don't have a lot of data yet of how this is going to manifest for us and for our patients. But I think it's very important to get a snapshot right now of how it's being carried out, how the primary care providers who are on the front line, the gatekeepers of PSA screening, how they're taking this information and implementing in their practice. Because it's up to us, it's our responsibility as urologists to intervene and offer them the support that they need and the education that they need, because they have a lot of specialties that they cover as general practitioners, and we as specialists in urology can help them in interpreting and in caring for their patients for PSA screening.
Study author Jesse Salmon from Henry Ford Hospital in Detroit believes there is a need that the U.S. Preventive Service Task Force recommendation isn't focusing on, namely, screening of African American men.
Sure. What we found is that in African American men in 2012, there's a wide degree of heterogeneity in screening practices nationwide, and that oftentimes states that have the highest percentage of black patients or black population are associated with lower rates of screening. As urologists, we need to stress education of primary care providers on the needs of screening in the black population, particularly those at risk 55 to 69. We need to increase the advocacy for better healthcare policies for at-risk populations undergoing screening for prostate cancer. And the available data is limited on the effective screening in black patients, and therefore we need to focus our research endeavors on looking at PSA screening, particularly in black men, because the guidelines are inconsistent within this patient population.
Dr. Chang says all 3 studies highlight urologists' concerns about the task force recommendations.
I think the clearest message is that fewer men are being screened for prostate cancer by PSA. For what reason and why they're not getting screened, that's not necessarily clear, but there clearly has been a change in that. And unfortunately, that change has affected the men that are most likely to benefit from screening.
Whether the recommendations or how they are developed will change remains to be seen.
I think the guidelines are in evolution, and I think we will start to revisit these guidelines. It's interesting that the guidelines were created without the influence of any urologists on the panel or medical oncologists or radiation oncologists, people who treat prostate cancer. So the recommendations were essentially made from individuals who don't deal with prostate cancer on a daily basis.
I'm Anna Maria Iannetta reporting for Urology Times.